Good morning. On behalf of Sri Bharatiya Vidyapeeth, MGM Group of Hospitals, the portal Learning General Surgery, and the marvelous medicine portal, I have a great pleasure in welcoming you all. I'll ask Dr. Vidya to take over from here.
Now I welcome Hamdan Asad to introduce Dr. Sridhar. So Hamdan is a first-year medical student at the Mahatma Gandhi Medical College and Research Institute, Pondicherry. His hobbies are crocheting, gardening, and reading. He's an animal lover and avid writer. And according to his classmates, he keeps boring them with the details about reptiles. He wants to become a plastic surgeon and he jumped at the opportunity of introducing Dr. Sridhar.
A very good morning to one and all present here today. I have been given the honor to introduce Dr.K.Sridhar, a distinguished figure in craniofacial aesthetic and plastic surgery. He holds an MBBS and MS in general surgery from Kasturba Medical College, Manipal, and specialized in plastic surgery at Government Stanley Medical College, being one of the first batches in 1978. He further trained in the USA, Mexico, and Taiwan. Dr. Sridhar has held significant positions including Pro Vice Chancellor of SRM University and Senior Vice President at SIMS Hospital, Chennai. He has contributed to national health policy and held leadership roles in major surgical associations. With a 44-year career, Dr. Sridhar pioneered craniofacial and leprosy reconstructive surgery in India. He has received numerous awards, including the Lifetime Achievement Award from Tamil Nadu Dr. MGR University. Dr. Sridhar is not only a pioneer in plastic surgery, but an experienced adventurer. He has trekked Mount Kailash, which is a whopping 18,400 feet tall. He is also a creative soul, spending his free time making crafts and painting. Without any further ado, please welcome Dr. K.Sridhar with a huge round of applause.
Good morning, everybody. I think it's really nice. Hamdan gave a good introduction. I hope I inspire you to become a plastic surgeon. And since it is the first talk, I think it is not going to be more on subject as such, but on generalized view what I have. So I thank MGM Healthcare, Balaji Vidyapeeth, Marvelous Medicine, and the Learning General Surgery for giving me this opportunity. Every Thursday, 8 p.m. for the past 3+ years, week after week, these two people have been helping others rise in marvelous medicine. Now from Madras to Pondicherry they have come. So this is a famous Tamil movie, great story showcasing every aspect of human life. Now the wheels on medicine is being ranked here into Pondicherry, not by those two, but by these two. This is again a great service, encasing every aspect of surgery and our profession. When you look at a field like this, when the tree grows, you see the achievement of marvelous medicine for the past 4 years plus. But what you do not see is the equal amount of the struggle which these people have put in to achieve what they have achieved today. The struggles are, you can see here, the roots take all the resistance, hard stones, dark, moist environment. But what we see is a comfort of the auditorium or the laptop at your house, and you see only that part of the marvelous medicine. I thank Radhakrishnan and Vidya for taking up the struggle for us to watch this growing beautiful tree. Peek into my professional life, making of a plastic surgeon, my journey. That was the topic which has been given to me. They thought being a plastic surgeon, we put our hand everywhere, right from head to foot, so that it would be a generalized thing rather than talking about diabetes or an orthopedic or any specific problem, because we are not good at everything, but we are good in something everywhere. That is ours. I am not sure whether I can call myself successful, but one thing I'm sure is I had a very satisfying career and in my life. Success is measured by others. So they may feel that I am successful, but satisfaction is my own. I think that is what is more important for us. I am not a copybook, neither I am a role model. I don't want any of you to follow any one of us. because then you will lose your originality. I think you should be what you are. Each person has different strength and capability. As opposed to trying to change them, it is important to make them become and help them become the best version of themselves. If Hamdan is going to be a plastic surgeon and it is his heart, his passion, then my duty is to just mend it and bring out the best in him. Let us not waste a lifetime trying to be somebody else. When my father was practicing medicine in 1930 and 40s, he was a physician. He dispensed medicine like a pharmacist, did basic blood urine tests like a pathologist. Primarily, his practice was obstetrics, including mid-cavity forceps. He did wound suturing, abscess drainage, including parotid abscess, surgery for piles, fistula, reduced Colles fracture, and put POP. One man did everything. He was jack of all trades in a limited spectrum. His practice came to an abrupt end when he developed a stroke early, just 40 days before I was born. He was an hemiplegic, aphasic, and so I missed a father in an active field. So what happened is, he wanted me to pursue medicine. So it has been forced upon me in a way. My first love was mathematics and physics. I wanted to become an astrophysicist. I want to be one among them in this group. I would have sat if I have continued in this group. Maybe unknown to anybody, but fate took me to that side. I landed up in Kasturba Medical College, Manipal, because the previous year appeared for an interview in Tamil Nadu. And the interview, they asked me the question, how cement is made. I answered the question. The second question was, how asbestos was made. I didn't answer. And I came out and said that I did not get the C. That is how the interviews were those days. And somebody told me there is a place called as Manipal. I never knew where it was. I knew Manipur in geography, but never heard of Manipal. Then I landed up there in that place. The cycle called as a tiger circle. Totally new environment, incessant rain. Have you ever seen anybody wearing umbrella like this? And rice packed in this hay like a round ball rather than in a gunny bag. My new type of food, some never heard of, leave alone tasted, like a banana bun, goli bhaji, uppittu, kabudu, and red boiled rice. Everything has been alien to me. Challenges or the alien environment. For a Tamil medium student, I was from a Tamil medium student. I learned English only on the 6th standard. For a Tamil medium student, from a tier 2 city, Coimbatore, exposed to ultra-modern social life in Manipal. Student from all over the country and abroad. Only lingua franca to communicate with each other student is English, in which I was very poor. To communicate to the locals, a totally unknown language called as Tulu. That is something you can understand at a 17-year-old boy seeing everything against you. Obstacles or opportunities. Everything in either man is either to grow or there's an obstruction for you to grow. The choice is yours. So I decided to choose. I chose, I will grow, even in this environment. So I think that is the first lesson possibly I would like to tell. Whatever be the environment, wherever you are, whatever it is, you decide to grow, you will always grow. Manipal introduced me the real world and laid the foundation for the world to know me later. So, which college you study? What do you do? Whether it is self-financing college, government college, ultimately what is your life? That life is what is important. The best part of my life was spent in Manipal, drenching in rain and soaking with joy. It's not always we get what we want. Remember that sometimes not getting what you want is a wonderful stroke of luck. My Manipal life exemplifies that. My journey began in 1966 in Manipal. As a medical student, you could see the stethoscope, which you would not have seen, which could be bent like this with a bell and a diaphragm, and that is called as ether. That is what was the anesthesia which was used. And you could see here the needle and the thread with which you used to stitch the intestines. This is the thread we used to use. We call it as 40 count and 30 count, which is nothing but from the tailor shop almost. Only difference is it was rolled in a rubber tubing or it was rolled in this wooden All other things are same. 44 years since I have become a plastic surgeon. This is my 45th year of plastic surgery. This was what we were doing those days, and now this is what I do. This is my journey. I would have become irrelevant long back had I got stagnated with what I studied as a postgraduate student in plastic surgery. I don't do 80% of what I learned as a PG student today. In other words, 80% of the work has been replaced by studying after becoming a plastic surgeon. In other words, you have to grow, you have to keep walking, never stop. Now you look at this picture, you will see there are 4 things. One is a Rajdut motorbike, other one is Amitabh Bachchan, then you have a standard Padmini, and then you have a Chetak scooter. The only thing today relevant is Amitabh Bachchan. All other 3 have disappeared. The reason behind this is he reinvents himself to a crorepati now. He was in a movie, now he has become a quiz master. So he was able to adapt. So what is required for everybody is to adapt yourself to the changing circumstance. You could see here, this is the 1981 same plastic surgery clinics I read. Now this is the year. You could see here what year it is. So continues to do. You have to read that. Then you have to upskill microsurgery, craniofacial surgery, and anatomy dissection. Again I did 10 years back. Just went back to Manipal, to my parent institution. I asked them to allot a body and did some dissection just to keep in touch with the development which had taken place in anatomy. Anatomy doesn't change, but we do change to have a different perspective of the same anatomy. 73 to 76, I did the MS. I thought surgery, madam will not agree with me, Vidya, that Vidya will not agree with me. I felt surgery has definite answers to problems. Then other specialties. See, when you look at it, bacterial infection and mechanical problems are the only things which are treated commonly. All other things are controlled, or all other things are, you must say that diabetes, you only control, you don't cure it as such. Hypertension, you control, like that. Any others are controlled. This is us. So we thought that we had excellent teachers like this who taught me life, not only surgery. I never had MRI, we never had CT, we never had ultrasound. Can you just tell me 5 minutes? We never had any of those. Only thing was, not even ultrasound. Remember, when I did my MS, we didn't have ultrasound. And we did only clinical examination. Which side pupil dilates, that side you do the burr hole. If it is delayed, opposite side you do burr hole, because the midline has shifted. This is what was done. And I used to do Colles fracture reduction. I used to do fracture femur fixation, because there were no specialists there. So we did everything. Craniotomy for head injury, exploratory thoracotomy, basic fractures of Colles and neck of femur, and complete urology except endoscopy and oncology were done by general surgeon. We were real general surgeons. So we were able to train. That helped me a lot in plastic surgery. Wherever is the part which has to be reconstructed, you knew what to do. This is a great man by name Nayak who gave a talk that inspired me to become a plastic surgeon. This is the only specialty without any restricting your imagination on, because it is sex or age or system. Neither it is heart, nor it is lung, or it is liver, or it is abdomen, anything, anywhere, without any restriction. If you can imagine and then do it, and then improve the condition of life, then it is plastic surgery. I coined the tagline, making life meaningful to live. It is not life in quantum, it is in quality, so that you live a meaningful life. So I coined this term, tagline, making life meaningful by plastic surgery. I am like a sheep. Nibble little bit of the grass and then go to the next grass and nibble, and then it goes. It never grazes like a cow, taking off everything. I have little bit of artwork here and there, and also problem solving. I thought it fits in very well, because I need not concentrate on any one thing. I can do everything or anything what I want. So plastic surgery gives me that widest scope possible without confining you to a system. MCH plastic surgery, I joined in Stanley Medical College, which is called as the Mecca or the Louisville of India. There we did hand surgery, one of the pioneering institutes of hand surgery there. I joined there in 1978 and became a plastic surgeon. Now, a lot of people have a concept about plastic surgery is like this, that we do something plastic, we put plastic in, we take plastic out. So that's why I put that. We are all creative, so even the slides will be sometimes like this. That is me standing there. My anesthetist stand that side. Raghavendra was there. All of them were inside the plastic. Why we call it as plastic surgery is plastica just means to mold or shape in Greek. So as this material can be molded or shaped as required, we mold the tissues as required. It was called as plastic surgery, which is a misnomer. That's why most of the people don't know what is plastic surgery, and they don't want to do it, and they don't want to refer it. That is also convenient for us. When they don't refer, we take up something else. When we take up something, somebody takes up something else, we go to some other place. So either we do jaw, when maxillofacial surgeons take it up, we go to the leg. When the orthopedic surgeons do hand, then we can do onco reconstruction. So we have all armamentarium. I don't complain about somebody else taking it up. You do what is best known to you. That's a very good thing for you to learn. We mold and shape the tissue as required, both in quantity and in quality, to restore ultimately function, not the beauty. Reconstruction surgery is the most appropriate term rather than calling it as plastic surgery. We celebrate our Plastic Surgery Day on July 15th of every year, called as the Indian Plastic Surgery Day. And it so happened we started it off somewhere in 2011, and in 2017, the world adopted the Indian Plastic Surgery Day as the World Plastic Surgery Day. That is another imagination that we could do. Was why July 15th, I started it as July 15th, because we could celebrate, we can do all camps, etc., without the school closure, without the examination tension for the parents. So July 15th, nothing happens around. So we decided that is the time best suited for conferences. Now, anywhere there is a tissue defect, deformity, or a disability, plastic surgeon is called for. And we always reverse the problem. I suppose many of you might have seen this video. They are unable to get the head out. So plastic surgeon views it the other way around. The head does not pass through. That means the body has passed through. That means you reverse it, let him come, the body can come this side. Why pull the head that side? So this is the way we view the problem. So you have a plastic surgery problem. You imagine how it was originally. If it is contracted, you recreate the defect. I will give you an example, and with that, I will come to an end. So from head to foot, congenital or developmental, trauma, burns, infection. I think one of them was Patta's case, I think, or Apollo case, this perineum. Tumors, jaw. Always take up challenges, keeping in mind our patient's requirement. I tried my hand in flying. As I told you, I put my hand everywhere, wherever it is convenient for me. Thousands of satisfied and thankful patients. This is original hair, not wig. So what we call it a tissue expansion, which never imagined when I was a PG. You could expand the remaining skin of the scalp and then put this. Microvascular surgery, we were one of the first to do it in our country, in Stanley Medical College. This is the amputated thumb, which has been put back. This is a microvascular surgery. Craniofacial surgery, I was one of the earliest to start in the country. There was a craniofacial surgeon who asked the question, Francis, pourquoi pas? That means why not? So I also asked that question, why not? And started doing it on my own. Now the latest is 3D printing, which I have started adapting now. I do print 3D models of the defects. You could see here the tumor removed, we have planned. Entire resection was also done by us. And then the fibula has been bent. And then as per the plan, which goes back into that place, and now you can see here the result. Same way we do patient-specific implants now. I do 3D printing, convert it into titanium, and then give you the whatever area is required. So from head to foot, anywhere there is a defect, deformity, disability, you can think of us. Research is something which you have to undergo. On administration, never leave. You must get into administration somewhere or other if you want your department to improve. If you want your life to improve, you must be part of administration. Any compromise in administration is tantamount to compromise in treatment plan. Then I did a public survey, leprosy work, and cleft and craniofacial in Sudan. Do not go where the path may lead. Go instead where there is no path and leave a trail. 35 years back, I started my trekking. I completed it in 2018. Now, no more I do trekking. So many years I have been. That is the original photograph, old photograph of slide of 35 years back. And now it is the present Kailash trek. This is the team. Without them, I'm nobody. Thanks for giving me this opportunity, Radha Krishna and Vidya. I'm just sharing you something. As usual, vague. It is up to you to pick up what you want in this. Thank you.
They're plastically fixed.
Well, let me set the ball rolling. As a plastic surgeon, you've got lots of young people, very beautiful people. How do you see beauty from your eyes?
Beauty from my eye.
In your viewpoint as a surgeon, a plastic surgeon.
Yeah, beauty is perception of somebody's eye. That is the answer. Actually, beauty, where it lies is in the eyes of the beholder. There's nothing called as beauty. What is beauty to you is ugly to another person. What is ugly to one is, so therefore its own person's perspective. So I feel that I'm all right with all my teeth which are one in front and one in back. I have never done anything for that. Neither I have done anything to do my crooked nose, which is there, you can see here. Maybe my perception is it's fine with me. So, but the other person may not feel so. I think beauty in my own, this thing is what the person feel I'm ready to do. Supposing they say, beautify my nose, no way. I can't beautify your nose. But you can tell me, I want this to go, I want this to narrow, I want this to be sharp. Yes, then I can tell this I can do, this I can do, this I can't do. If that is all right for you, I will do. That's how you have to view. Because ultimately what they view and what I view may not coincide. That is the problem in aesthetic surgery. Both our perception must match.
So as you said, sir, it's more of function as well.
Exactly. That's why I put the term reconstructive surgery rather than
Beauty is
aesthetic.
the beauty is within to see.
Yeah, beauty. That's why I have left mostly, except the breast one I showed. I have left it up completely because that will come automatically when you apply the same principle anyway.
Thank you, sir. Thank you. We encourage the students to ask questions. See, the idea is for you to be inspired. You can ask any kind of question. That's why we set the ball rolling with a very general question. So please feel free to ask questions. We are here for you. Thank you.
So we'd like to show our appreciation with a small memento, and I request Hamdan to do the honors.